Glad to be joined by a gentleman with an interesting title. He's an addictionologist as well as a psychologist here on the island. For the last 15 years, medical director of Sunspire Health of Hilton Head, Dr. Ravi Srivastava. Doctor, thanks so much for joining us. We've been talking and hearing about nationwide the problem with opioids. How are we doing in South Carolina and maybe especially on Hilton Head? Do we have an epidemic here as well?
Thank you, Bob, for having me on the show.
Sure.
There is an epidemic of opioid use going on in the nation and South Carolina as well. In 2014, approximately 449 people died in South Carolina from overdose of opiates. In 2015, more than 600 people died of overdose in 2000.
Wow.
And it has been reduced by our EMS because in 2015, about 4,600 shots of naloxone were given by our EMS to people who had overdosed, and thus they saved their lives. In 2015 and 16, 6,400 lives were saved by our EMS by injecting them with naloxone.
Wow, that is a huge explosion in it, as you mentioned, an epidemic. How does one become an addict, and what are we doing about it?
Well, that's a complex question. Addiction is a medical illness. It is no different than having diabetes, hypertension, or bipolar disorder. You have a genetic predisposition to it. You don't choose to become an addict. You're exposed to the drug or alcohol at a certain age. Mm-hmm. A lot of people are exposed to it, but they don't become addicts. Only some do. But once you become an addict, it is there to stay. It's like a medical illness. It is a chronic relapsing illness. It is there for life. You may not use any alcohol or drug from a certain date onwards, but you still have the illness, which is inactive.
All right. What does Sunspire do to help fight the addiction in our community?
Sunspire Hilton Head opened up about 2 years ago, as you recall, and WHHI was there for the inauguration. And over the last 2 years, we have served over 600 residents from all over the country in Hilton Head. They stay with us for approximately 4 to 6 weeks and receive intensive residential treatment in the form of family therapy, counseling, medication to decrease their cravings and prevent relapses. The focus of treatment is not quitting drugs, but preventing relapses, because 90% people relapse within a year.
Wow.
But
Yes.
if you are sober for about a year and a half, only 20% people relapse. 80% people are successful in staying sober with adequate treatment. No medical illness has that great an outcome if provided appropriate treatment, which we do at Sunspire.
That's fantastic to hear that after about a year and a half, that number tips like it does. What can a family do to find out more information about Sunspire and how to get treatment for a loved one?
Oh, the best way to find more information about us is to come and visit us.
Okay.
On 19th of October, we are celebrating our second anniversary from 3:30 to 5:30 p.m. Drop in, meet our staff, talk to the therapists and the counselor and the people taking care of them. Meet the doctors and the nurses, and you will know what we do. Also, if you want more information, come to our website, sunspirehealth.com.
Okay, that'll do it. Thank you so much, Doctor. We appreciate the information. Very important problem that you have laid out for us, and certainly you also laid out some treatment for it, and that's fantastic. Dr. Ravi Srivastava of Sunspire Hilton Head, thanks for joining us.